I don't know, it was weird.
We can go over peak and trough. What I've been taught, I don't know what Emily was going over, but, okay. So, vancomycin, what do you guys know about Does anyone know about vancomycin?
It's like one of the ones for MRSA and that.
It's like it's like the most heavy-duty antibiotic we have. And in fact, there's just been recently, in the last few years, a vancomycin-resistant bacteria. And so they have to go on like 3 antibiotics to kill this bacteria because vanco doesn't even work for it, which is like scary, you know?
Yeah.
So they do what's called a vanco peak and trough lab draw. And I'm talking about vanco, but this is how peak and troughs work for any medication. But vanco's the one I know because I've seen it in the hospital. So anytime we say peak, that's the highest level the drug gets to in the body, or reaches, or whatever. And the trough, it's the lowest. Pretty straightforward. But for vanco to work, we have to have them at like an adequate, area most of the time. Like we have to have them at what's called a therapeutic dose, or it won't kill the bacteria. But we also can't have it too high because then it can become toxic and really dangerous. So you draw the trough 30 minutes before, I think this is what she was talking about. You draw for the trough level 30 minutes before your next dose, because you need enough time for the lab to get up there to draw it. But and that's also probably about the time the med is the lowest in the body, right before it's due again, right? So that's when you would draw for the trough level. And then you would draw for the peak at the peak of the med. So if you were to look in your drug book, vancomycin IV, I think the peak is like 20 or 30 minutes or something like that. So you would draw the peak at that time. So you would give it, tell the lab to come up in 30 minutes and draw for the peak level. So the point of a peak and trough is just to prevent too high, but to maintain adequate amount for accomplishment of why I'm giving it. So to kill the bacteria.
So it's all just to keep it in that therapeutic range.
Exactly. Because let's say vanco, the trough level is like super low, and let's say for vanco they want my peak for someone to be between 5 and 6 mil. I'm totally making this up because I don't know what the value is. Let's say I want the peak to be about 5 to 6 milligrams per kilogram of body weight or something like that. And let's say I draw this peak lab level and they're only at 3. Well, I need to up their dose then.
Yeah.
Or let's say they're above that, I need to decrease their dose. Because I might need 20 milligrams every 4 hours and you might need 10 to get to the same therapeutic range. Does that make sense?
Right. Totally.
So it's going to be different for every patient. They have like a standard dose that they do, and then they have to adjust it precisely by this peak and trough lab level. Another drug that I feel like I have heard them using is Dilantin. So you might hear Dilantin or vanco. That might be what they use in your scenario if they were testing you on a peak and trough. And kind of what happens, I don't know if you guys knew this might be an important concept for you to know too. If someone comes in with something, they will take a sputum culture, and we always want to do those before giving any antibiotic, because if I give an antibiotic, I can mess up the results of any culture after that. So they will start the patient on a general antibiotic, and then once the results come back, they'll put them on a specialized one like vanco or penicillin or something like that. So, anyways, but we always want to give the lowest dose possible to get that therapeutic effect. We don't want to give them a lot of certain drugs. Does that make sense? Does that help with the peak and trough?
It just kind of made it seem like the way she explained it, that it was like for every drug you do this. And I was kind of,
No.
Yeah, and then in class.
Vanco is the only one I've ever seen used in the hospital. And in the computer, it says vanco, peak, and trough. Like you order the specific peak and trough for the drug. So it's not for every med. Just vanco, and then very rarely I have heard of Dilantin. But even then, I don't really know how often they do that. Maybe if someone was having adverse effects with like respiratory issues, they would start.